think the first thing is to check the knowledge and the understanding of the person in the first place. So you might ask a question like, what do you know about cancer, or what do you know about spread of cancer, for example. And you listen to what the patient says, and that gives you the cues to how to approach it from that point on. You might need to fill in information, and you understand that when you're filling in that information to the patient, they're not going to hear terribly much of it. The severity of the news stops them from taking in more than the core material. So you have to perhaps repeat what is said several times, and you write down the information so that they can refer to it later on. Some people even use tape-recorded cassettes and hand those cassettes to the patient to listen later on. You acknowledge that what is being talked about is very difficult, and there will be an emotional reaction to that, and you give them permission to express that emotion and support them in expressing that emotion. You take cues from the patient about how quickly you provide information. It might be that it's not the right thing to give them everything all at once. You might need to give them 2 or 3 points and then stop and get them back, give them the next bit of information. You might check to see what they've understood, bearing in mind that they're not going to take in all that much. It would also be useful to have people bring in relatives and friends, a close confidant, so that 2 people are hearing the information rather than 1, if you know ahead of time that you've got a problem coming up. And that allows for a discussion and reflection later on. And I think the most important thing is to follow the consultation up, get them back, get them to write down questions that they have, so that in the sort of period of reflection after the consultation, they think of all of the things that are going to be questions that they need answered, and then they have the opportunity to have those fully explained the next time round.